go for it.
Hello, listeners. Thanks for tuning in again or for the first time. Today, I am talking with Michelle Moyle, fabulous proprietor of Integrated Podiatry Clinic located in Melbourne, Australia. As future-focused as we are around here, it stands to reason that we will not be able to enjoy the future as much if we are in pain. As many of you already know, my mission is pain-free longevity, and I seek out intelligence on mitigation and what we might do early on to give our bodies the best chance to deliver quality service to us for as long as possible. When I posed the idea to Michelle, she required a bit of convincing because she said, "I don't know that I have anything to contribute." Which, listeners, as you shall hear, is modesty personified. Prepare to be a bit astounded by the wealth of information Michelle has to share that can help you mitigate future pain, all stemming from the foot. Michelle, welcome. Thanks for overcoming your initial reticence and agreeing to have a chat with me.
Thank you. Thanks for having me.
If you haven't tuned in to Shifting with Elizabeth before, you may not know about our studio game, which I say, let's play it right now. Are you ready?
Sure.
She shook her head no and said sure at the same time. So it's a bit of a yin yang. So the name of our game is What is Your Current First World Problem, Michelle?
Oh, God. I don't want to sound ungrateful because, it is a first world problem. But yeah, I guess, just almost like not having enough time in the day.
That is a common response. And when you say it, and actually you really nailed the reason for the studio game by saying you didn't want to appear ungrateful, because it is sort of an opportunity for us to focus on things to be grateful for. Because like my first world problem today was technology was failing me, right? My VPN kept dropping. That's my current first world problem, that my privacy network was failing me. And so when you talk about not having enough time, does it come down to prioritization?
Yes. And possibly that I try and fit too much into my day and not, which I guess it is prioritization.
And who loses? Are you shorting yourself?
Oh, yeah, always me.
Deprioritizing the self, that is a common theme as well with people that I'm talking to.
Mm.
So did you overcommit by coming here today?
Well, this was obviously already in the schedule, so I just tried to figure out a way to fit everything else around it, which, yeah, has me running around like a bit of a headless chook.
Well, you look fabulous. It's not
Oh,
showing at all.
that's
But,
kind.
so I guess the reason we're playing the game, everybody comes at it totally different, right? And if you're saying that I guess what I'm kind of hearing is that you're a people pleaser. Would that be accurate?
Yes, definitely.
And so we need to try and prioritize ourselves and draw some boundaries,
Mm.
maybe.
It's
Mm.
always one of those things, and you're better off, guiding people in that direction than you are sometimes taking your own advice.
We're all really good at telling everybody else what to do.
Mm.
But you can see why we play the game, right? It gives us a
Oh,
little
yeah.
pause. And I'm excited to draw the parallels that I see in the work that you do on people's feet for our listeners, perhaps helping a few people in the process. So it'll become clear, listeners, why we're talking about feet. It is related to the rest of our bodies, health, more so than we know. So I'm curious, Michelle, how are you drawn to the foot?
Well, I guess I had I guess an early history in playing a lot of sport. I did a lot of running. I played a lot of netball. So I was always very conscious of my feet, and particularly with my running, very conscious of having my feet in the best condition possible to obviously make me run faster. And then I had parents who would see a podiatrist regularly. So we were kind of, my sister and I were exposed to that from a young age as just being a normal appointment in our sort of, wellness program, I guess, people who you see to look after your body. And podiatry was always just one of those things. Like we were physio, we did the chiro, we did the podiatrist, we did yoga, we did meditation, and it just kind of fell under that wellness banner from a young age.
That is amazing. Your parents are very unique.
Very,
I
yes.
kind of want to go down that rabbit hole because that is not a standard story from someone's childhood, is it?
No, not really. Well, not back then anyway. Probably more so these days.
A little bit more. I mean, I know that in my pursuit of trying to cure my hip before I went to Haley, I was going to a chiro, and he was all about his children being part of the chiropractics from a young age, and he was homeschooling, and and so he was all off on his own independent streak. But but that's yeah, it is really unique. I'm really your family is just amazing. You're so lucky. Do you
Mm.
feel really lucky?
Yes, I do. I would feel very, very lucky to have the parents I had. And yes, obviously being exposed to so many things from a young age has, I guess, helped me formed a bit of a routine for myself. Obviously, I've spoken about not having enough time already today and not prioritizing myself, but I think there is an underlying level of um, understanding that, it is important to make yourself a priority. My dad was the biggest sort of cheerleader of that. He would always say, put it in your diary, make an appointment to have a massage, to whatever, put it in the diary, otherwise it'll never happen. And he lived his life like that. So he was a great role model to, yeah, to sort of, I guess, prioritize that stuff. And my mum, she was, similar. Obviously, he was a big driver of that though.
I love that. I do that, put things in my calendar. And I think maybe you find this that if you've elected an evening to stay in and do your laundry and have a quiet night for yourself, and someone calls up and says, "What are you doing tonight?" And you say nothing. So I'm not doing anything. And it's not true, is it? You have plans with yourself,
Mm,
right?
yeah,
And I think maybe a lot of us do that. If we're staying at home to have a nurturing evening for ourselves, we get an offer from outside, we're saying that that's not as important as what we planned. Do you find
yeah.
yourself going there?
Yeah, definitely. Sometimes if I'm I'm really exhausted, I will honor that night that I have planned to do nothing, like actually nothing, sit on the couch kind of
Hmm.
thing.
Yeah.
Just because I know that it's not really going to serve me or the other person if I go to the catch up and I'm tired and I'm, thinking about when I can leave. Like I wouldn't want to be on the receiving end of that. So I think about it that way too.
A really good point because that then we're separating out the ego of thinking that our presence is really so incredibly valuable that
Mm,
even if we're half speed, that's better for the other person somehow.
mm,
No, I would rather rest and see you when I'm better. I'm curious. So, but okay. So I love that your parents were connected to sort of non-mainstream interventions toward health. I think that's a fantastic foundation that more of us could incorporate. But I mean, that doesn't really answer the question of why you decided to make this your life's work.
yeah, well, I guess, yeah, from my mum's perspective, like, so seeing she had bunions, so something that a lot of women experience, but she was in a lot of pain with her bunions, and to the point she actually ended up going down the route of having surgery on them.
Mm.
But seeing her, I guess, in the pain that she was in, naturally kind of piqued my interest, wanting to, I guess, understand a bit more about that. And, I guess, as a child, you want to help your mum in any way you can. But also, I think it was, yeah, so from that running background, it really obviously I was focused on the feet, but it really did come back to how were my feet working to make me run faster, but how they connected to the rest of the body. And I guess the whole overall arching theme of like your feet aren't separate from the rest of your body, but also like I wanted to know how, yeah, I just became very interested in how they worked, how the body worked. Very, we all have bodies. Why don't we know more about that?
I love that you're talking about how the connection between the feet and the rest of the skeletal system and also internal organs. So if you could kind of give us a tutorial, a 101 on how the feet do impact the rest of the skeletal system and maybe what organs it you might have some impact on as well. I guess that's the word.
Yeah, well, um, I guess our feet are naturally connected to the rest of our body via, yes, like you said, the skeletal system. So you've got the bones. Obviously, bones are connected by ligaments. So each bone kind of connects to the next bone via a ligament. So that kind of forms our structure. And then we've got obviously our muscles, and muscles are connected to bones via tendons. So our muscles, or actually everything in the body is kind of held together by a network of connective tissue that you've probably heard of called fascia. So
Yes.
fascia is, you can think of it like spider web like, in the sense that it is very thin, um, and it's almost like a nylon stocking, how it kind of like holds everything together. So our fascia runs through our muscles, through our organs, around our muscles, and so it runs sort of all the way, or it depends. I look from the bottom up, so you can say from the head down or the bottom up, but it runs right the way through from our feet to our head. And
I
so,
was I'm sorry to interrupt, but I was picturing it, and maybe this is wrong because you say it's thin. I always pictured it sort of like a fishing net or
yeah,
like
kind
a
of.
bag, the bag that oranges come in.
Yeah, something like that you could think about.
Okay.
Yeah, it is
Okay. And then
very,
everything is held inside this orange bag,
yeah,
essentially.
you could have
All
think of
right.
it like that. Yeah. So it is quite thin when you see it. I've been lucky enough to have done a anatomical dissection during my university study. And so to be able to like we had cadavers at uni, and to do a dissection on a leg, we were able to actually see that deep fascia and see it, yeah, bounding, I guess, or binding around muscles and running through muscles. And so through this network, you can say that basically everything in the body is connected.
Right. And so that fascia can it become calcified, hardened, and kind of stuck in space? Or in
Yeah, it's
place, I
kind
mean, by
of
space?
um, like almost dehydrated in a way. You want to keep your fascia hydrated. So doing things like foam rolling, obviously drinking water and things like that, but foam rolling really helps to hydrate. Fascia, there's different, things you can do to help your fascia, um, yeah, sort of function in its, I guess, best way possible.
So that it's agile and it doesn't become calcified because I wonder if like the tightening of it and then it results in some pain in that spot. Does that make sense?
Hmm. Hmm.
And I know yin yoga is quite beneficial
Hmm.
to keeping the fascia
Yep,
pliable.
absolutely.
Um, and so what about internal organs? So we've got this fascia that's like the bag and all of our stuff is on the inside.
Hmm.
And yes, so our bones and our tendons and our ligaments are all connected, but I got this suspicion that, like my kidney could be connected somewhere to a point in my foot. Is that maybe it's not my kidney, but maybe it's something
Hmm.
else. What is it?
Hmm. So that would be more looking at something like reflexology, where yes, there are definitely different parts of the foot that correlate to different organs in the body. So when it comes to reflexology, we're looking more towards like um, TCM, traditional Chinese medicine, where they focus on the meridians of the body. So the meridians being like energy channels, and obviously having blockages in some of these energies channels can result to a physical manifestation of pain or problems or that kind of a thing. So yes, in that sense, the foot using from a reflexology standpoint, you can have areas of the foot that are related to different organs in the body.
Does that lead us right to the dry needling? Because we've had some amazing success with the dry needling in my sessions, and for anyone interested, yes, it can be very, very painful, but once you break through, wow, what a difference. And so is the dry needling part of what you were just discussing with the energy, or no? Are they separate? Tell me more.
A little bit separate. So dry needling does, I guess, stem or come from acupuncture. So we're obviously using the same needles and I guess some of the same points in a sense, but with dry needling, we are looking to focus on trigger points within the muscle. So
Okay.
as opposed to using the meridians. So if you were having acupuncture, that's what they
Mhm.
would be looking on is like the channels, the meridians, those lines um, to target different, I guess, organs or certain, yeah, I guess, organ components that they look at in Chinese medicine. So you can say, yes, it has, I guess, been derived from that, but it is using a slightly different principle. So I think this is where we're looking at the muscle and the myofascial trigger points in the muscle.
So the dry needling is for trigger points, and the
Yes.
myofascial trigger points in trigger trigger points in the foot, right?
Yes, so a lot of the well, yes, there's definitely foot points, but then we also do a lot of lower leg dry needling because
Yes.
those areas in the leg, they have referral points into the foot. So we needle the leg to address the foot.
So now, I mean, I'm fully reminded of that very old song, the thigh bone is connected to the hip bone,
Mm-hmm.
etc. And so
Mm-hmm.
we're proving the viability of those lyrics. Well done. And earlier, Michelle had to pause recording because she had a delivery at her door and she got some new shoes, which leads me to what I want to talk about. I want to talk about shoes, um, because tell me what we're doing to our bodies when we put on our shoes. And I want to talk about men too. I don't want men tuning out because, oh, it's only about women, because I feel that the men's shoes are not doing them any favors by and large as well. But you know more than I do.
Mm-hmm. Yes, so footwear is quite an interesting topic. It's very contentious, obviously. There's so many different opinions out there on what shoe is best for you. You will have people, yeah, very pro barefoot. You will have people very unpro barefoot shoe. Um, so yeah, it is, there's a whole spectrum really, but basically there are many layers to it and there are many different approaches we could come at it. But if we think about our barefoot, how maybe, a while ago, from a tribal perspective, if people were going around barefoot, and definitely still happens in different parts of the world, our feet are obviously the first things that come into contact with the ground. So there's a lot of information that our feet pick up from the environment around it. So this is I guess, when our foot hits the ground, it needs to be able to absorb shock. Some may say that some shoes do not allow for that. So therefore, if our foot is not naturally absorbing the shock from the ground reactive forces, is that then traveling into the body, traveling further up the body and causing us to have hip pain, back pain, neck pain, that kind of thing. So
It's not allowing it to absorb the shock because the shoe is absorbing the shock,
well, yes.
or
So sometimes, depending on like having cushioning in a shoe is sometimes not necessarily seen as a good thing because it can dampen that ability of the foot. That is one aspect of the shoe. So what happens when our foot hits the ground is that there's a level of vibration coming from the ground. So if we're walking on concrete, there's no vibration coming from that surface. If we're walking on grass, there's obviously vibration coming from that surface. Floorboards, a little bit too. So basically, our foot is interpreting those vibrations to be able to send messages to the brain to then get muscles to switch on, to cause the foot to have some stability, to have it to form a rigid lever so that when we push off, we have the foot functioning in an ideal way. So in basic terms. So if we're not getting that information from the ground anymore because we have a shoe on, then that is going to, yeah, make us tone deaf a little bit to the environment that we're in.
Interesting. So you're saying it's not necessarily the high heel, it's just a shoe full stop that's causing the hip pain?
Yes, it can be. And I'm not saying that we all
Wow.
have to go out there walking barefoot today either, but it is, the world we live in now doesn't allow for that. We're not going
No,
to be walking down the streets of Melbourne in bare feet, it just isn't going to
I've seen it, Michelle. Don't, I've seen it for
happen.
sure. But I'm also, because then I obviously selfishly I'm going straight to flat feet because I have them, and going barefoot, while it suits my sensibilities, doesn't suit my skeletal structure
Hmm. And
at
this is the
all.
thing too, is that because we have pretty much been in shoes from such a young age, our feet don't have the strength to, well, not necessarily, some people's may, but don't have the strength to withstand going barefoot all day, every day, and depending on different, um, I guess, foot problems, foot issues, then yes, barefoot may sometimes exacerbate it if you're not doing anything else to help yourself.
Okay. So we briefly touched on what organs, but can you access all the organs from the foot? Are
Um,
there points in the foot to everything in the body?
Basically through reflexology. So if you understand, like not every podiatrist does reflexology. So um, not
Michelle's
every
special.
podiatry, yeah, not every podiatrist will potentially agree with what I have to say. I guess it depends which way you lean. But yeah, there is a correlation between parts of the foot and different organs in the body.
I remember once we were talking about the connection to the heart.
Mhm.
So can you talk to me a little bit more about that?
So the heart point in the foot is around like the ball of the big toe joint. So
Okay.
if that makes sense, predominantly on your left foot too. So that area is where the heart is located. So you could say that, I guess, if somebody has a pathology in that joint, say at a bunion or whatever, then
Yes.
not saying per se that they have heart issues because I'm not, putting that out there, but it could be an energetic connection to the heart. So it may not necessarily be you have a heart issue, your heart is weak, or you've got an irregular heartbeat or something like that. It could be that potentially there has been a heartbreak, yeah, a grief, like something to do with the heart. Um, or particular meridian in Chinese medicine. So I don't know a lot about all of that because obviously I haven't specialized to that degree. And obviously, a Chinese medicine practitioner would probably be the person to delve more into the details around that. But yeah, that sort of thing.
Find these things fascinating, and I know that we had some real progress when we broke through that area of the foot with the mobility of my foot. So it's very interesting. So, um, one of the reasons that I thought it would be interesting for listeners to hear about what you do is because I'm interested in as much pain-free longevity as possible. That's a big complaint from people as they age, that their body produces pain for them. And so, what can we do today to assist a pain-free future from your perspective?
Mm-hmm. I guess I would just say number one is bring awareness to your feet. A lot of people sort of go through life maybe not having any foot problems, which is great, but then also not really like noticing their feet either, because we usually get our attention drawn to areas of the body that aren't working. And so with the areas that are working, we not necessarily forget about, but they're just not a priority because they haven't screamed at us yet. So
Right.
what I would say is just in general, just bring awareness to your feet also, because they are at the other end of the body and often get forgotten about and shoved in shoes and, out the door and that kind of thing. So just, you know, look at your feet for starters, maybe. If you can do it every day, great. If it's only once a week, that's fine. Um, Definitely be aware then of what's going on with your feet. So I always tell people to look at the skin, look at the nail health, look at things like that, so that you are aware before something kind of spirals out of control. Um, yeah, so that's one thing. And then you could just even give your feet some love by giving them a little massage. So that whether it's with your own hands or whether it's with like a trigger point ball, one of those spiky
Oh,
balls, that
yeah.
kind of thing, that will help work on releasing any tension in the fascia in your feet. So that is a really nice thing to do for yourself.
It is a nice thing to do for ourselves. And I love that you went at it from an independent perspective so that we can help ourselves. And then I just had this flash in my brain of maybe sitting at either end of the sofa with your feet shoved toward a friend and their feet shoved toward you, and you could maybe trade the massage.
Totally.
Yeah, good idea. So what would you say is the biggest drawback to the work that you do?
It's hard, like again, it's probably a time restraint thing. So obviously my appointments are one-on-one. So there is a limit to how many one-on-one appointments you can physically do in a day without burning yourself out.
Yes.
So there is that element. So you're only ever going to be able to, help as many people as you can physically, you know. Yeah, I guess how, you
Great.
can physically, yeah, exactly, in a day. There's also, it's quite like, our work is quite laborious. So there's a lot of postural things for us. Neck issues, shoulder, like that is one thing I do regularly, and that is I have like a chiro and a osteo and massage, and that is something that is like without fail, it appears in my diary, because without doing things like this for myself, I can't continue to give to my clients.
So your work is physically demanding.
Well, it is repetitive. So the way that
Right.
we sit, the way that we, I guess, conduct our treatments, yeah, they are repetitive. So it can lead to postural impacts over time. It is something I remember having the lecturers at uni drum into me about my sitting position, in ways to sit better or to raise the patient bed higher so that you're not slumping or anything like that, because at the end of the day, 20 years of doing that is going to end up, yeah, giving you a few issues.
Carpal tunnel or repetitive stress syndrome.
Yeah.
You need to work in quite a bit of mindfulness into the work that you do for yourself as well as your patients. And then you also need to elicit the mindful consideration from them. So you have a really demanding job. And listeners, may I just say, Michelle delivers just, I had no idea the level of stress she was dealing with. She's just a beautiful delivery in her office, and she does not feel stressed at all. Um, what are some little known factoids about the foot? You've got to have some, make us laugh. Have you got anything to make us
Mm,
laugh that has anything to do with the foot? I mean,
no.
no pressure.
Or maybe not from a laughing perspective for this one, but um, I guess mind-blowing perspective that each foot has 26 bones in it. So that is the largest, or the highest number of bones in one area of the body.
They're all tiny too, like a fish, right?
Yeah, yeah, yep, that's it. Some are very, very small. So, I mean, I always find that an interesting one because, 26 bones in the foot. People kind of say to me, how? Where do they all fit? But um,
Oh, really? Okay. I mean, do they align to the alphabet? Because that would make it really easy to remember the bones. That would be really helpful.
no, no,
You weren't thinking when they
unfortunately,
named the bones?
no. A lot of and anatomical things are all in Latin, so we had
I
to learn a
I
second language basically.
I did realize that as I was saying it. It's very tunnel vision of me.
Yeah. But what's another one?
There's
Oh, I've got one. It's not funny, but so one of my research projects during uni was we had a forensic case because at one crime scene there were only footprints left behind. And so we used it as our research project to say, is a footprint like a fingerprint in the sense that it can be an individualized thing? So we looked into it was more to do with like the size of the foot and I guess the toe break, which is where your toes meet, I guess, the
foot, like
balls
the
of the
base of the
foot.
toes. Okay.
Yeah. So, and the length of that. And in doing our research, obviously, we had to look up other research papers out there to see what had already been done and if there was any information that we could draw from them. And naturally, one of the papers that had been done was, is there a correlation between the size of the foot and a certain male appendage?
Penis, I think you refer to.
Yes,
We're allowed to
correct,
say it. Okay.
correct. So
And
because everyone always says, you know what they say about big feet?
big shoes.
And no, there's no correlation. So there you
Well, it saves us all a lot of market research on the topic, so
go.
thank you.
I don't know if that's funny enough, but yeah, anyway.
It's pretty good. I mean, I think everybody wanted to know, so thank you. Thank you. So for anyone who missed that little bit, there is no correlation between the size of the foot and the size of the male penis. All right. Well, too bad about that. Now what do we go by? No. Uh, so I think we did a little bit of what could we do at home for ourselves with the massage of the foot, paying attention to our feet, recognizing that they exist and support us all day
Hmm.
long.
Yeah,
Um,
choosing good shoes, that type of thing. So when I say good shoes, we want to look for, obviously, we don't want to be in as women high heels all day. That's just something that's not going to serve us well. Choosing a shoe that is wide enough for our feet. So, and
yes.
that's an issue that men have too with the shoes because some of their dress shoes and office shoes can be quite narrow. So we definitely want to be finding shoes that are wide enough that we can wriggle our toes in and that our toes don't feel cramped.
It's a good tip. I like that. And I would reckon, to get my Australian on, I would reckon that high heels don't allow for toe wiggling. What do you think?
No, particularly the pointy ones. So,
Wow. And other than that, I have one question. Where in the foot would we press to relieve pressure in the neck and shoulders? Because I feel that that is a very common space for some pain, and people would just love to be able to grab their foot and take their thumb and push it somewhere and maybe realize some relief in their neck and
hmm
shoulders.
I mean, it's hard to say if it will work for everybody. It's not.
Hmm.
Again, this is not a podiatry perspective. This is coming from more of the reflexology side. Um, oh, there's many different areas. I guess it depends on like so around like your fifth toe, like the ball of your fifth toe, that can be around like your shoulder area. Um, I mean, if you're stressed, if you've got a lot
Hmm.
going on, then I guess, if there's a lot weighing on you and your shoulders, the solar plexus, which is really in the middle of the foot. like if you sort of push in underneath the balls of the feet, just in the middle is one area. And
Next
similar,
to the instep, sort of,
yeah, that's it.
right?
Your adrenals are in the arch. So if you're feeling a little fatigued as well, that can, it's all related in that sense. So, you know, there's so many different layers to it. So it might not just be that it's a structural postural neck issue, but you're getting these, or shoulder issue, but it's secondary to stresses, adrenal fatigue, like emotional drainage, things
Hmm.
like that. So I guess there's a lot of different elements, but yeah, anywhere sort of under there or through the arch.
Essentially, just get your friend to massage your feet.
Basically, yeah.
Yeah, and also get one of those spiky balls so you can just
Hmm.
roll it around your foot yourself. That's really nice. And is there something I got a couple questions. Knowing what you do about the shifting Venn diagram, which is the physical, metaphysical, and the world of work, are there any metaphysical aspects to your work? We kind of wove it through with the traditional Chinese medicine, but is there anything we haven't touched on that you find particularly
Mm.
metaphysical?
Well, I guess there's a couple of things. So, um, I mean, this actually is sort of research backed anyway, but spending time grounding, so, barefoot on the grass, does allow for, I guess, the transfer of negative ions, the releasing of dense energy, that type of thing from the body. It can also, I guess, help with a lot of other things if you're experiencing any inflammation. It can improve immune function. It can improve, like, I guess I'll give you a faster recovery time from exercise. So that sort of, aching that you get in the muscles after doing exercise, then that can help, I guess, that.
Being barefoot in the dirt, is that what you're saying? Can
Yeah.
help
Yep.
re shorten your recovery time from working out.
Yes, yep, can improve sleep, can improve. These are sort of based off of various research papers. Can improve cardiovascular health, improve regulation of endocrine system, can shift from sympathetic nervous system activation to the parasympathetic nervous system activation. And this is sort of spending as little as 30 minutes a day, but going barefoot.
But outside,
Outside, yes, on the grass. So you need to be in contact with nature. So even if it's at the beach, on the sand,
right?
in the dirt, obviously we're safe to do so. Um, yeah, that I have to put that in there.
Watch where you're walking. And
Yes.
what would you like to see in the world that would help everyone's health by way of the foot? Now, beside we were already done awareness, we've done some massage. What's the next thing?
Mm. Your feet are often a reflection of what's going on inside too, from a systemic point of view. So
Is everyone looking at your feet, listeners? Are you all staring at your feet?
So yeah, it is. It is, there's a lot that can be said. So, even from how your nails are growing, how the state of the health of your nails, it's often a reflection of what's going on systemically. So, um, obviously, yes, watching your feet, give your feet a little massage, spend some time, grounding, spend some time, I guess if you're not in pain, just opting for better footwear, or spending less time in high heels if that is something that you tend to do. Definitely, doing some exercises for your feet too. So there are specific exercises that you can do to help strengthen your foot. There's a vast amount of different products out there that you can use to do all of this stuff. Yeah, there's just, you would probably want to exercise your feet like you exercise the rest of your body, really.
What do you have to say about mani-pedis?
Medi-pedis, well, I love doing them for people, and I highly recommend them over going to a standard nail salon. There are a lot of risk factors for going to your average nail salon, given that most of the equipment there is not sterilized, and that they are often removing hard skin when they're not meant to.
What would be the problem with removing the hard skin?
By them,
Yes.
one, maybe they're not trained. I mean, they haven't studied anatomy, physiology, biomechanics like we have.
Yes.
And often they're not doing it with sterile equipment. So if they cut you, then you've got a greater risk of getting an infection. If they've already used that piece of equipment on someone else and cut them with that
Yeah.
same blade and then have come to cut you, that's just something you don't really want to have to deal with in your life.
Well, it sounds to me that the way we began this by talking about your day and how you were maybe deprioritizing yourself with your schedule and squeezing in more than was humanly possible. We're ending our conversation in a similar way to remind listeners to pay attention to our feet, which is an often deprioritized piece of our body that takes a beating on our behalf. So let's talk about reprioritizing what's important, elevating ourselves, and maybe even standing on our heads so that our feet is priority one. What do you think?
It's definitely something we can try.
Michelle, thank you for taking some time with me today. I learned a few things, and it was super fun. And I hope that people take this a little bit seriously so you can have a longer life with less pain. You have anything you want to add?
No, I don't think so. I think it's just, yeah, as I said, it's just nice for people to reconnect with their feet. And even if that is doing a 5-minute body scan every day where you close your eyes, you take a few deep breaths, and you really sort of ground into your feet, then that is a really special thing you can do for yourself and just for your overall health.
I love it. Thank you very much. And I hope everybody has a good foot day.